Good evening. Welcome to the next episode of the AHS-AGHS webinar series. Tonight we have the privilege of Dr. Jeff Muigai joining us to take us through a presentation on lifestyle diseases with a focus on hypertension and diabetes. We welcome you to this informative session where we hope to learn more from him on what causes these diseases, how we can prevent them, and for those of us who are afflicted, how we can manage living with them. I'll allow him to introduce himself and give us a background of who he is, what his experience is, and then he can take us through the session. Questions are welcome. Feel free to post them on the chat. I will be reading through them. If anything comes up that is urgent, I will interrupt the presentation and have him answer. But if anything can wait until the end, we shall walk through all the questions that you ask, and he shall answer them one by one. For those watching the live recording and for those who are going to be watching the recording after the fact, karibuni sana. Take it away, Bwana Jeff. The floor is yours.
Yeah, thank you very much, Eric. So I'm Dr. Jeff Muigai. We were taught to always start by saying I went to Alliance, since this is the crowd. I'm class of 2005, number 8047, Grave House 13A, and I'm delighted to be here to be giving this presentation. I'm a virtual care doctor working in the telemedicine platforms called Antara Health as a primary health care doctor. So one of the focuses that one of the things that we focus on mainly is the lifestyle diseases, because we find that most of them are things that we can actually reduce through what we do. And because of that, we find that there are many things that happen. Like nowadays, we see a lot of these conditions coming in, mainly because of the way lifestyle has changed. Most of us are not very active and so on, as we're going to see in the presentation. So welcome to this presentation. Just forgive me for the lighting. Kenya Power has decided that today I will walk in the darkness, but I believe my voice is still walking in the light, as I strongly serve this purpose. So we'll start with the hypertension and just go through a brief of what it is and the nitty-gritties of it. And I'm sure most of us have heard about high blood pressure, which is the same thing as hypertension. And usually the blood pressure is the force that is exerted by the blood or the blood vessels. So remember, the heart usually works like a pump. So there's a part, and then the blood vessels that circulate the blood through the whole body. So the moment the heart pumps, it pushes the blood into the blood vessels. And that pressure that it uses is what we refer to as blood pressure. So when that pressure is high, that's what we refer to as hypertension. So this is a condition where the force of the blood against the walls of your blood vessels is consistently too high. So at times we'll find that if a doctor finds your blood pressure is a bit high, they will tell you, go monitor for a while. Usually we need at least 2 readings that are about 6 hours apart for us to be able to diagnose this. And the problem with this is that usually that pressure will give a strain, or will put extra strain on your heart and now cause other complications, as you're going to see as we move along. And when you're looking about the blood pressure, because people wonder, okay, somebody has taken my blood pressure, so what does this mean? So you will see most of the time when we do a blood pressure, usually we'll record it into 2 readings. So you'll be told that your blood pressure is this over this. So there will be an upper reading and a lower reading. So usually the upper reading will be looking at the pressure in your heart when it is pumping out blood. Remember we said the heart is a pump. So when it is pumping out blood, the first reading usually looks at the pressure at that point. For the lower part of it, remember, once it has pumped out blood, the heart has to relax in order for blood to fill in again, so that it can get blood to pump out. So when it is relaxing, the pressure in the heart is the lower one. So you'll hear somebody talking about something like, my blood pressure was 120/80. So the 120 is the pressure when it's pumping, and the 80 is the pressure when it is relaxing. And usually when you're looking at the normals, so the top one, we usually call it the systolic, and the lower one, we call it the diastolic. So the diastolic usually should range between 90 to 119, or the diastolic should range between 60 to 79. And then if you take your blood pressure and find that the systolic is between 120 to 129, or the diastolic is below 80, then we start saying that your blood pressure now is elevated. And then from the newest guidelines now, we start saying that your blood pressure is high if the systolic is 130 or above, and when the diastolic is 80 and above. If you take your blood pressure, it's maybe even 139 over 85. It's high, yes, but not to the levels that need medication per se. So we'll be seeing at some of the things you can do at that juncture to bring it down. But now we start getting worried. The blood pressure, the systolic goes above 140, while the diastolic goes above 90. And we've seen people even having blood pressure as high as the systolic of 220, which is usually quite dangerous and can bring a lot of effects on your body. So why are we insisting on these conditions? If you look at hypertension worldwide, it affects 1 in every 3 adults. So you can see how common it is, and it is the leading cause of cardiovascular diseases. Cardiovascular diseases are diseases affecting the heart and the blood vessels, which are the number 1 cause of death worldwide. In Kenya, you can see we are at about 25%. So that means 1 in every 4 adults in Kenya actually has hypertension, which is a major public concern. And I think the worst part about this concern is that some of these people don't even know that they have hypertension because they usually don't get checked. And when you look at the risk factors for hypertension, usually we divide them into 2. We divide it into unmodifiable, that is the things that you cannot change, and the modifiable, that's the things you can change. So like for the unmodifiable, some of the things that can affect you are your age. Of course, you know that if you're supposed to turn 50 years tomorrow, there is nothing you can change about that. You just have to turn 50. So you cannot change anything about your age. It has been shown that as you advance in age, the risk for developing high blood pressure also increases. Then the other one is family history. So we found that there is a genetic aspect to hypertension. So we find that hypertension is approximately twice as common in subjects who have 1 or 2 hypertensive parents. What we need to remember is that it's not a must that if your parents have hypertension, you will get it, because all these risk factors, they marry or gel together to give you this condition. Then you will see when we get to the modifiable ones, they're actually the majority ones. Then the other one is the race. So black patients have been found to be having more severe hypertension than the whites. And the black also, it occurs much earlier in life, and it's associated with greater organ damages when it comes to the complications. Also, if you have other chronic illnesses, for example, you're having issues with the kidney disease, chronic issues with the thyroid gland, these ones can also predispose you to develop the high blood pressure. Then now we go to the modifiable. This is actually where now everything comes into play. And these are the things that you can actually change all the way from our youth and follow these things religiously. Number 1 is physical inactivity. Nowadays, we are seeing these conditions a lot. If you've noticed, nowadays we have a lot of people working from home. Cars have become so accessible nowadays. You just need to, almost everybody has a vehicle. Just get into your vehicle in the morning, go park it outside your workplace. You work in the first floor or the second floor, but believe you me, you still go up using a lift. Just 1 or 2 flights of stairs, you're still using a lift. Go sit down on your laptop the whole day. The only breaks you are taking are just bathroom breaks. And this is very common with so many people. So you find that physical inactivity has become a very big challenge nowadays. and it has brought about a lot of these lifestyle diseases. And something else that affects is smoking, especially products that are having nicotine. So whether it is the cigarettes, whether it is the shisha, or the vapes, all those things, as long as it has nicotine, that increases your risk. And then we have obesity. Obesity has everything to do with your weight. And what we usually do, we usually calculate what we call your body mass index, which is calculated from your height and your weight, because we know according to your height, it's supposed to carry a particular weight. And the moment you start exceeding that weight, then now it becomes a health risk to you. And these are part of the things that usually affect it. So one of the issues that will come in is the high blood pressure. Then the other one is high cholesterol levels. Again, these ones, they come from what we eat. We're going to see as we move along. Poor diet management, especially high sodium diet. I'm sure you know sodium is what is the main component, or one of the components in salt, the sodium chloride. But we have many forms of salt. I know we have this habit, the people who have a habit of always having a salt shaker. As you're eating, you're adding salt into your food. Or you're eating nyama choma. You have usually I smile when I go to these joints where they bring you the nyama choma in that wooden platter. And then at the corner there, they've put a heap of salt. And as you're eating the nyama choma, you're busy just, marinating the piece of meat with the salt. So this is one of the greatest risks for developing high blood pressure. So I think from now onwards, anytime you're touching raw salt, just remember you're touching hypertension. So ideally, salt should be cooked in the food. It should not be on the food. That's something that I hope you'll get from this. Then we have alcohol abuse. I know some people are happy that I've used the word abuse and not use. So unfortunately, we abuse alcohol a lot. And we know that the normal alcohol use actually ideally should be, for men, just be 2 bottles of beer. For females, 1 bottle of beer is enough in terms of use. Anything above that, now you're abusing alcohol. When it comes to 2 tots for men, 1 tot for women. And the same for wine in terms of glasses. So anything above that now becomes abuse, and now it increases your risk of getting these lifestyle diseases. Then you have drug abuse, things like cocaine, methamphetamines, all those can increase your risk. And then another important thing that people ignore is persistently high stress levels. I usually feel bad when I look at, for example, how our country is right now. People are very stressed with everything that is going on. That by itself already is a risk for developing these lifestyle diseases. Now, when it comes to the symptoms, one thing that we need to note about hypertension is that by the time you're getting symptoms, most of the time, the hypertension has actually gone very high, or the blood pressure is actually very high. So the only way of knowing it early is if you get into a habit of having it checked. So if your blood pressure has been high, we advise it's good to be checking it at least once a year. If there's a time it has been high, or from the risks that you've discussed, you're at risk of getting high blood pressure, then it would be prudent to have the pressure taken more frequently, when as frequent as every 3 months or half yearly, depending on how the readings are. Some people even do monthly, depending on the risks that are there, just for us to be able to detect it before it starts bringing issues. So by the time you start getting the symptoms that are listed there, then it means your pressure already is very high. And some of the symptoms include dizziness, numbness of the heart and the feet, feeling fatigued, you have slept well, you woke up, you've gone to work, but still you feel your body is tired and you cannot explain. It's one of the things you need to check is your pressure. Headaches you cannot explain. At times it can cause heart problems. So you find that your feet are getting swollen, or you're trying to do some tasks and you're becoming breathless. In some instances, you can get nose bleeding, especially when it is very high, and also it can affect your vision. And when you look at how it can affect your body, and this is in terms of now the complications that can arise. So in the brain, you find that high blood pressure can damage the blood vessels there. So it can either cause them to burst. So you find that a blood vessel supply in a particular area of the brain bursts. So that means that particular part of the brain will not get blood, or they can clog through a clot. So a clot can just block the blood supply to that part. And now this is what usually results to a stroke. So I'm sure probably you've seen someone with a stroke. Half of their body is paralyzed and they are not able to do anything with that. Also, it can affect the vessels that go to the kidneys, causing kidney failure. So you've seen people who are requiring dialysis just because of that. And then in the bones, it can lead to elimination of calcium, so thereby reducing the bone density and increasing your risk of getting fractures. You've already mentioned about the vision. It can affect the vision. In the heart, it can cause heart failure. The heart pain mainly is what we refer to as the heart attack. So when the blood vessels that are supplying the heart itself have been affected, then it's unable to pump effectively. And then finally, this is a very important aspect of our life. Hapa ni pale tunasema hypertension inaguza murema. This is whereby you find that one of the effects that come from high blood pressure is erectile dysfunction and decreased libido. And how do we prevent hypertension? So looking at some of the risks, of course, it's controlling some of the risks. So number one, we manage stress. We said chronic stress can raise blood pressure. So it's good to find ways of managing your stress. Things like meditation, deep breathing, yoga, or whatever works for you in terms of relaxation. Some people usually it's going to the gym, taking a walk. Just do whatever it does. If you feel you need therapy, don't be afraid to seek for help, because also it helps a lot to help you, just talk out your issues. If you're smoking, just quit. Smoking has nothing beneficial. It just increases your risk of getting many issues, including cancers and the rest. And it damages your arteries, thereby increasing your risk of getting high blood pressure. So for people who are smoking, we encourage them to quit. And then, of course, like we said, it's important to keep monitoring your blood pressure so that if it is high, it can be managed. And even if it is not, at least you're able to know how your body is and how your pressure is always. And I've already mentioned about salt. Please, that salt shaker, get it out of your table. There should be no salt that you should be adding onto food. All the salt should be cooked in the food, and when you eat, you should not feel like it is bitter or it is a lot of salt. Now, most of the time we think that the only salt we eat is the salt that is in the food. But you'll be shocked that, things like processed foods and canned foods, if you go and buy things like sausages, bacon, they're already having salt in it, even as part of preservation. So if you are used to taking these, junk foods a lot, you'll find that in a day you're actually eating a lot of salt, which is not good for you. So when it comes to food, we prefer just go for fresh and natural options instead. When you go to the supermarket, try as much as possible to read the labels and try to see if there is any form of sodium, because these things are usually given a lot of names. So you might see names like monosodium glutamate, sodium citrate, sodium bicarbonate, sodium alginate. So as long as there is sodium, then that is salt. So there's an aspect of salt, and usually it should not be more than 0.3 grams per serving. If you see anything more than that, then that means that's excessive salt. But if you can be able to avoid these types of foods, then the better for you. Then when it comes to diet, If you're able to increase your potassium intake, usually it reverses the effects of the sodium. And this is usually mainly found in fruits and vegetables. So we encourage, just make sure every meal you take has vegetables and you have fruits. And they have also other added benefits. They are roughage. They also help with your stool. They also increase your immunity. So you get a lot of benefits from just eating right. If you are taking, for example, cereals in the morning, just try to make it a bit balanced. You can add a banana. Bananas, have vitamins. They also have potassium, or even avocados, or add even a sliced tomato to your bread in the morning. That makes it a bit more healthy. If you're having eggs for breakfast, you can also add more flavor by adding tomatoes, bell peppers, onions, mushroom, or spinach, just to make it well balanced. And then just make sure at lunch and dinner you include at least 2 portions of vegetables. If you're making soups, you can add grated or chopped vegetables to the sauces, just to make them more balanced. And when you are looking at prevention, there is a cholesterol reduction. So here we are saying try to limit fast foods and deep fried foods, things like sausages, cookies, samosas. These are things that we love a lot, but unfortunately, we know these things are cooked with oil. They are full of cholesterol, which now comes and brings all these issues. So instead, just try and replace these with healthy snacks and foods like roasted nuts, fresh fruits, dried fruits, or low-fat diet. Also try and watch your egg and dairy products intake. They also have high cholesterol, so thereby limit them to about 3 eggs per week and about 1 cup of milk per day. Then limit fatty meat intake. And we know most of the time this is usually in the red meats. So if you're able to do more white meat, the better. White meat includes things like chicken, fish. You also have the rabbit meat. So those can also be good alternatives. Then eat more fiber-rich foods like whole grains, cereals, legumes. This can actually even be replacements for meat. Instead of eating meat all through, you can use these cereals, things like beans, and the likes. The other thing that usually helps is also look at the oil that you are using to cook in. So usually we prefer you use things like olive oil, sunflower oil, corn oil. And the reason for this is these ones have a lower cholesterol than the other fats that are solid. And again, this is another scam that is here in our country. For those who have bought, at times they tell us these oils are good, they're cholesterol free. But if you see any oil, and I'm not trying to demarket anyone, any oil that is not in a clear bottle, there are those brands that you see they're in yellow or some other colors that you cannot see the oil inside. If you put that can in a place that is a bit chilly or cold, what you'll notice is that it will start becoming solid. So that tells you it is saturated fat. So the ones that are usually in clear bottles, you will never see them turning into solid, no matter how cold it is. So just opt to use those kinds of oils when you're cooking. And then when it comes to management, the most important part is actually the lifestyle modification. And in lifestyle modification, we are looking at diet. So we have something that we call the DASH diet. That's a dietary approach to stop hypertension. And this one means we are looking at restricting the sodium. So we don't say don't use salt, but just make sure it is in the food and not on the food. Make sure your diet is high in vegetables, fruits, low-fat dairy products, whole grains, poultry, fish, nuts, and low in sweets, sweet beverages, sodas, those artificial juices. Just try to, especially in our setup where most of our works, they entail sitting down, you're not doing anything actively, you are engaging in some exercise, and you target at least 150 minutes per week. And make it consistent, because there are some people who will do that will not help you. So just make sure you are consistent and make it as part of your lifestyle. Exercise, you can see alone on average that you've talked about. You have to keep monitoring your blood pressure for us to see that even the drugs that you're taking are actually controlling your blood pressure. And if you're managing it on lifestyle management alone, then at least you have to keep monitoring to make sure that the lifestyle changes you are actually doing are working. Yeah, so that's about hypertension. Then we'll get into diabetes mellitus. So for diabetes, we all know diabetes is about blood sugar. And this is when the glucose in your blood is too high. And this happens when your pancreas does not make enough insulin or any at all, because the pancreas is the one that produces the insulin that helps with metabolism of glucose. Or when your body is not responding to the effects of the insulin properly. And glucose usually comes mainly from carbohydrates in your food or drinks, and it's the one that actually your body uses for source of energy. And your blood carries glucose to all your blood cells or your body cells for the use of energy, whether it's in the brain, in the legs, in the muscles, wherever. They all need this glucose for them to be able to do their normal metabolism. And once the glucose in your bloodstream gets to where it is needed, the insulin also works as the key. It's the hormone that usually will make sure that that glucose gets into your body cells. So that means if your pancreas isn't making enough insulin or your body isn't using it properly, then the glucose will build up in your bloodstream. And this is now what causes the high blood sugar, what we usually refer in our circles as hyperglycemia. And if you look at the statistics, globally, we find that 1 in 10 people have diabetes. In Kenya, we are looking at about 3.3% of the population. By the end of this year, it was expected to increase up to 4.5%. But now here's the sad thing. About 2/3 of the population are not aware they have diabetes. So that means someone is just walking around. They have never checked their sugars. They actually have diabetes, but it is undiagnosed. And diabetes cases have been on the rise, again, due to these issues of the lifestyle. In consumption of unhealthy things, physical inactivity, high BMI. So one thing you will note here is that some of these risks are the same as high blood pressure. So you find that if you are able to handle these risks, then you actually reduce a lot of illnesses, not just even these two that you're talking about, because we know some of these are even related to even some form of cancer. So that means if you're able to maintain a good lifestyle, then you're able to keep off quite a number of illnesses. If you look at the types of diabetes, we start from the pre-diabetes. So pre means before. So this means that this is before you actually diagnose the diabetes. So maybe just as a basis, usually you will find if you take a blood sugar reading, so usually we'll have a random blood sugar. Random blood sugar is when you take your blood sugars anytime during the day. And that one, the normal range should be about 3.5 to about 7.1. If it is above 11.1, then now we say that is diabetes. But if it is between 7.1 and 11.1, sorry, that in between is what we usually refer to pre-diabetes. Then there's another test that we usually check, something we call the fasting blood sugar. So fasting blood sugar, usually maybe you've been told to go to hospital in the morning and have your sugar checked before you have taken anything. So you should have fasted for about 6 to 8 hours. And for that, usually the normal is about 3.5 to around 5.6. And we say you're diabetic if it is above 7.1. So again, you can say there's like a period between 5.6 and 7.1, which now we again put it as pre-diabetes. So the sugars are not normal, but again, they're not high to the level of us saying that you're diabetic. And then the last thing that we usually check is something that we call the HbA1c. So this is a test that usually looks at your average sugar averages for about 3 months. And the normal for this usually is around 4 to 6. We say you're diabetic if it is above 6.5, but if it's about between 6 and 6.5, then again you fall in the pre-diabetes. Pre-diabetes is the stage before actual diabetes. And most of the time it's something that we're able to manage through lifestyle modification. And then from there we have type 2 diabetes, whereby the body does not make enough insulin, or your body cells don't respond to insulin, which usually we refer to as insulin resistance. And this is usually the most common form of diabetes, and mainly you will see it in adults. So if you see somebody being diagnosed diabetes, in their 30s, 40s, 50s, most likely it will be type 2 diabetes. Then we have type 1 diabetes. This one mainly we see it in young adults and children. And this happens because of an autoimmune condition, whereby the body fights off or fights the cells in the pancreas, thereby destroying them, and now the pancreas is not able to produce insulin. And so you'll find for patients with type 1 diabetes, most of them will need to be on insulin because they are not able to produce any, so they have to be on those injections. And then we have gestational diabetes. This one mainly affects women who are pregnant. So usually it will be seen in pregnancy, usually the late half of the pregnancy, and usually disappears after about 12 weeks after delivery. But something to note is if you are diagnosed with diabetes that is pregnancy related, this by itself increases your risk of developing type 2 diabetes. So that means even if it goes back to normal, you really have to make sure your lifestyle management is on top, and you keep monitoring your sugars to make sure that in case they start going up, we're able to detect that earlier and manage it. If you look at the epidemiology, around 1 in 8 adults have diabetes in the world. In Kenya, we said it's around 3.3% of the population. Yeah, but very few people actually get tested. Just a random check here. Some people, since they were born, they don't even know what is their blood sugar levels. So we encourage us to, just have these checkups. If your sugars are okay, just do it annually. If you know you are at risk, then you can do it more frequently. When you go to the risk factors, again, you will see a lot of similarity when it comes to risk factors for diabetes and what we discussed for the high blood pressure. So you can see obesity is there, physical inactivity, alcohol abuse, tobacco use. And if you have high blood pressure, that also gives you a risk of developing diabetes as well. And the things you cannot change, things like age, race, if there's family history of diabetes, or if you are female and you've had a history of the diabetes during pregnancy, that also increases your risk. Again, for the symptoms, just like we said in hypertension, in diabetes, when it is going up, remember, these things don't just go up in one day. Usually it is a process that takes time. It might even take, some people it takes even 5 years for them to be diagnosed with some of these conditions. Unfortunately, the more the sugars stay high, the more it damages your body organs and increases your risk of getting complications. So that's why we keep insisting on checkups, because that's the only way you'll be able to detect it before it brings about all these complications. But if your sugars are high for long periods of time, some of the symptoms you may get include an increased frequency of urination. So you find that you keep going to the toilet, washroom to urinate, you don't know what's happening. It can also increase your risk of getting urinary tract infections, or for the females, yeast infections, extreme exhaustion, unintentional weight loss. Unintentional weight loss is where you are losing weight, but really there's nothing you are doing to lose the weight. It's not that you cannot attribute it to exercise that you're doing or to a particular diet plan that you're following, but still you're losing weight. And then also intense hunger or thirst. So you find that you're always very hungry. You always want to you keep taking a lot of water. If you've had the sugars high over a long period of time, you might start experiencing some tingling or numbness in the hands or fingers, the toes. And then also, we know that one of the things that is synonymous with diabetes is slow healing wounds. So you can get a particular injury that you expect should have healed, within 2 or 3 days. But you find 2 weeks later, the wound is still there, it's not healing. So one of the things that we usually check when we say that is your sugar levels. So for the diagnosis, I've already mentioned, I talked about the fasting blood sugar, the random blood sugar, and the 3 monthly test that we usually check, the HbA1c. So those ones, usually you can always start with the random test. When we see there is an issue with the random test, we do the fasting. But for checkups, usually we love the fasting blood sugar test. It usually gives you an accurate. So if you're able to do that, the better. HbA1c usually is now for follow-up, just to see how the average of your sugars are. So this one will not look at your sugar at that particular time. Usually it will look at the past 3 months, how your average has been. Yeah, so when you look at the population that requires regular screening, because these are some of the people that we ask them to get checked more because of their risk. So anybody with a body mass index of more than 25, or if you have a first-degree relative who is having diabetes, or you're a woman who has previously been diagnosed with diabetes in pregnancy, if you have a history of cardiovascular disease, that disease affecting the heart or the blood vessels, if you've been told you have high blood cholesterol levels, or for women there's this condition we call polycystic ovarian syndrome, which usually causes insulin resistance. So for them, we also encourage regular screening. But if you have been checking and their blood sugars are okay, then you can do them annually if you don't have any of these risks. Then when it comes to management, we have the medication and the non-medication. In the non-medication, mainly is the lifestyle management, whereby we first of all start with education on diabetes. Just educate people what is diabetes, how do you prevent it, how do you manage it, and how do you avoid complications. And then when it comes to the diet, we'll see the slide that will show us how the diet should be in diabetes, because we know that most of these sugars come from the carbohydrates that we take. And then the other important thing is exercise plan. Exercise, like we said, is very vital that we increase our physical activity, because physical activity will increase the insulin sensitivity in our body, and this helps to manage the blood sugars. So whatever you enjoy doing, some people do things like walking, cycling, whatever you feel works for you. Nowadays, we even have YouTube videos that you can follow and just do the activity that they are doing, and it helps you to exercise. But what is most important is it must be regular, it must be consistent for it to be able to help you. And of course, you cannot deliver the fact that you have to keep regularly checking your blood sugars, just to make sure that they are maintaining within the right ranges. And then when you're looking at a diabetic plate, so this is how a plate, when you're serving someone with diabetes, this is how it should look like. Previously, I know we used to tell diabetics you should not eat this. If you want to eat rice, you must only eat brown. So nowadays, to avoid or to increase compliance, we don't lock out many things, unless now the ones that we know are actually, things like sodas and, anything with sugar. Those ones, that is, we try them to avoid. But when it comes to food, the normal food they can eat, but what matters is the portion that they are eating. So you can see, for example, in this plate, half, the part in green, half of it is actually vegetables. And so you have to make sure that half the plate is actually vegetables only. We know the African way of eating. If I told you to tell me how you eat, most likely the green part, that's where you will put all your ugali. So if you are not diabetic, now your plate should be in thirds. The way you're having the vegetables being half, it should be in thirds. So you should divide your plate into 3 thirds in a way that a third is vegetables, a third is ugali or whatever the starch is, and the other third is the protein. But for diabetics, it's a half and 2 quarters, where the half is vegetables, 1 quarter is now the starches, then the other one is the proteins. So when it comes to the starches, we prefer if they can eat the high fiber ones. Things like boiled maize, plantain or matoke, sweet potatoes, brown ugali, things like that you eat and they take longer to digest as opposed to things like bread. And then they should try and limit refined grains like white bread, mandazis, cakes, biscuits. If they can avoid, the better. When it comes to the protein side, choose fish, poultry, beans, and nuts. Try to limit red meat, and these dairy products like cheese. Avoid bacon, sausages, and the processed meats. Then at least have 1 small portion of fruit per day, maybe like 1 small apple. And then as much as possible, try to choose whole fruits over fruit juice, because the whole fruit usually comes with, the additional benefits of fiber and the rest. And then make water you're drinking, or rather your drink of choice when you're eating. Just try and avoid sugary drinks like sodas, milk, sweetened dairy products. And then when you're cooking, try to use liquid vegetable oils like maize oil or sunflower oil, or for cooking and in salads. So just like I had said in hypertension, I usually advise people just look at those ones that are in clear bottles. Then physical activity. Before starting any physical activity, ensure it is safe and appropriate to avoid any risk of injury. So for example, don't just wake up one morning and you decide you're going to run along the Thika highway, for example, or you're going to ride your bike in the highway without even a helmet. So just make sure that whatever you're choosing is something that will be risk-free to you. And then there are usually 2 main categories of physical exercise. You have the aerobic or endurance exercises like walking, cycling, swimming, and dancing. And then you have the anaerobic or resistant exercise, things like lifting weights. What we advise is that at least spend 150 minutes per week. So this roughly comes to about, half a minute, 30 minutes, 5 days a week. Again, you don't struggle hitting this 150 minutes, because at times you usually see people who are, you say maybe you want to subscribe to the gym, and you keep saying I'll go to the gym, go to the gym, but anytime maybe you leave work late, you wake up late in the morning, so you find that a whole year ends when you're just saying, I will go to the gym, or you keep saying, I don't have 30 minutes. I cannot get 30 minutes in a day. So I usually advise people just start with what you can. The simplest exercise that you can do with no excuse is a simple thing like skipping a rope. So you can get rope, and just even skipping 20 times will take you a minute or less. And you cannot, given any chance, you cannot say that you cannot get 1 minute in a whole day to do 20 skips. And what this happens is that even when you start with those 20 skips, with time your body will get used to those 20, and you'll actually want to do more. So maybe you started with 20 last week, and you find that by this week you've even hit 100 and more, and your body now gets used to this exercise, and it's actually demanding this exercise. When the moment you don't do it, you start feeling and there's something you're missing, you've not done. Whatever small thing you can do, just start it, rather than waiting to do the 30 minutes and you'll never hit it. So just build up to that. Start with the 5-10 minutes per day as you build up to those 30 minutes. And then try and do simple things that you will not have excuses of why you're not doing it. If you know you'll not make it to the gym, don't put it as an agenda that you start doing gym. Start with things that you know are simple, things you can do even just before getting to the shower, and it will go a long way when it comes to your health. In terms of medication management, here we are mainly looking at the drugs that are used for managing diabetes. So mainly people will be on tablets, others will have to be on the insulin injections. So again, this depends on various factors like the type of diabetes you're having, the level of your blood sugars. So these are discussions that usually we'll have with your health practitioner, but at the end of it all, the goal is to bring the sugars back to normal levels. Again, in conjunction with the lifestyle management that you are doing. So if you're on medication and you're not eating right, you're on medication, you're not exercising, then we are basically not doing anything much. So this has to be together with the lifestyle management. And it's also very important that you make sure that you take your medication as prescribed, and in case of any side effects, don't just stop the medication, but report the side effects to your healthcare provider. And then when it comes to complications, we have cardiovascular complications, for example, the heart attacks and the stroke. It can also affect the nerves, which is usually a common thing that comes with diabetes. So it can cause numbness, tingling sensation on your feet and on the hands. It can also affect your kidneys and cause kidney failure. And if you go to any dialysis center, you'll actually see we have a lot of diabetics who are there because either the diabetes has not been well controlled or it was not diagnosed in time. Thereby they need dialysis or even transplants. Then diabetes can also cause retinopathy. This is whereby it affects your eyes and can actually lead to blindness. Then we have the other common condition, it can affect your foot. So again, what happens is that you find, for example, it affects the nerves of your feet. So like if you go to the village, people like sitting like next to the fire and enjoying the heat. So someone with diabetic, they might not know, for you might be too close to the fire and you start feeling you're burning, so you'll get out or you'll go further away from the fire. But someone with diabetic will not have that sensation, so they might actually end up getting burnt without knowing. Also, if they are farmers, they can even get pricked by, things like nails, and they will not feel pain. So it develops a wound, becomes infected, and then with time you find that there are times the only way to deal with that is to amputate the foot. And then, just like hypertension, it can also affect sexual function, whereby it causes things like erectile dysfunction and vaginal dryness. And then you can also get oral health issues such as gum diseases. And for prevention, we have primary prevention, whereby in primary prevention, actually you don't have diabetes and you're preventing yourself from getting diabetes. And you have already mentioned better eating habits, physical activity, reduced alcohol and tobacco use, and regular screening for those who are at high risk of diabetes. So these are the things to do if you don't have diabetes and you don't want to get diabetes. And then secondary prevention is for people who have already been diagnosed with diabetes. And for these people, what we are trying is to reduce the risk of the complications that they get. And so this is, of course, again, doing the same thing, lifestyle management. If they need medication, proper use of the management of the, or rather proper use of the medication. And then from there, we make sure that we monitor their sugars regularly. So even encourage them to have that glucometer or the glucose measuring gadget at home so that they can be able to check their sugars frequently. Yeah, so with that, I don't know whether there are any questions that anybody may have.
The first we had was on the issue of the BMI. Question came up. Is it not for the other race? What's your take on that?
Okay. Which race are you talking about?
The non-melanated race.
Yeah, because when it comes to BMI, remember we said BMI stands for body mass index. So we are looking at the relationship between your height and your weight. Regardless of your race or whether you are young or old, their height or your height, rather your skeleton is supposed to hold a particular weight. So anytime your BMI is more than 25, that increases your risk for these lifestyle diseases. So yes, BMI is important for all of us.
Thank you. The next question, what is your take on lard and other animal-based fats?
Yeah, this has been another controversy that has been there because the studies that have been there have been showing that most of these animal fats actually have cholesterol or are high in cholesterol. So that's why you find that even things like the red meat, most people will tell you to avoid them because they have been shown to have the cholesterol and also increase your risk of getting, cancer such as the cancers of the colon. So I cannot conclusively say, because I know nowadays there are these discussions that are coming in about beef tallow and the rest. But for now, the safest in terms of oils is the vegetable oils. For now, that's the lowest when it comes to the saturation of cholesterol.
And how do you rank grain oils versus vegetable oils?
Which are the green oils?
Grain oils, like for example, like from seeds, like the canola seed, the sunflower seeds.
Oh yeah, they're all part of vegetable oils. They're all considered to be part of vegetable oils.
Oh, okay.
Of course, some people prefer the seed oils more, but yeah, they're all in the same group.
Okay. One final question we have. So there's a growing trend on the use of some extreme diet and exercise regimes to reverse diabetes. What's your take on that?
Yeah, so when you're looking at the diets and exercise, number one, you're trying to look at what are the risk factors that are there for this person. Because, for example, today your BMI, let's say, maybe your weight is around 100 kgs, and ideally you should be 70 kgs. So we need to lose around 30 kilos. Then we have this other person who is 70 kilos, and probably they're just overweight by about 2 or 3 kgs. So for them, they might require less intense exercise and dieting to get to their normal weight than this person who is having an overweight by 30 kilos. So you will find these interventions that come in to try and bring down this weight. Of course, we said reducing the weight has great benefit. So whether it is doing the intermittent fastings, nowadays we have the keto diets, with whatever the exercises they are doing, as long as it is not increasing any risk to you. For example, you're not having heart issues, and then you're forcing yourself in the gym, and then now end up getting other complications because of that. So as long as it has been certified as safe by your healthcare practitioner, and especially if you have been diagnosed to have diabetes and your medication. If you don't have, then you can try and go back to as normal BMI as possible using those interventions. And yeah, there are many. Actually, that's like another whole topic of discussion. Because there are people even who end up going for surgeries. Nowadays, you have the bariatric surgeries whereby we reduce the size of your stomach just to make sure you don't get full quickly. The only things we don't encourage are these medications. There was this drug called Ozempic that people were injecting themselves to try and reduce weight. So those are some of the things that we try to discourage because they were made for other reasons. Yeah, I hope I've answered that.
I think that is it in terms of question. Any other questions from the floor? Maybe I'll give like a minute or like a few seconds for somebody to type that will be having a question. For the elderly and diabetic, what are the exercise options, and how do you tell danger signs that they are not able to verbalize?
Yeah, so like I was saying, it depends on how mobile they are, because you might find that if it's somebody who can be able to walk, then even walks are enough. Just whatever, just to make them a bit active. However, you might find that there are some who are either bedridden or they are they're on wheelchairs. So for those ones, the exercise might not be much. They might just need physiotherapy just to keep their joints active. So yeah, it depends on the range of mobility. So you might find that in some cases you might actually concentrate more on the diet aspect than on the exercise part. And then now for the danger signs, now here with elderly are like children. You see, like the way a child with fever, you just see them, they were playing, then all of a sudden they stopped playing. So even for the elderly, you might find that maybe all of a sudden they are sweating. That can be a sign of even the sugars are going too low. Or even if they're able to talk, you see now they're excessively drowsy. Or depending on how you're collecting the urine, you start seeing the urine is too much. That is excessive urination. So it's basically the more you stay with them, the more you understand their normal self. And when you see something that is outside the normal that you are used to, then you'll know that this is now the time that you need to act or just check the sugars, because that's why we advise that just have those gadgets at home. So that when you see anything abnormal, you're just able to take the sugars and you can tell very quickly what is going on. Yeah, and then I see the other question about the spleen transplant, whether it can reverse type 1 diabetes. So actually it's the pancreas that is usually having an issue. And so far we've not seen transplants for the pancreas being done. So maybe once it comes about, maybe it can be something that will help. But for now, we don't have any pancreatic transplants that have been done to try and reverse type 1. Yeah.
Any other questions? Since we are over time, I will ask you, Jeff, maybe you can share contact information. If people need to know more about these lifestyle diseases, how can they reach you? Where are you based? And in what way can you help them?
Okay, so like I said, I mainly work for a telemedicine platform. So yeah, our clientele is a bit limited, but yeah, if you have a Jubilee card or Britam or Fast Assurance, we are having some arrangements with them. Otherwise, if you need to reach me directly, my phone number is 0721 486 002. 0721 486 002. So that you can reach me directly, and I can do what to advise you wherever you are, and things that you can do, whether it's somewhere you can go close by or any advice that you may need. Yeah, thank you very much.
Thank you very much. So we'll have that contact information in the description once we have the edited video up and online. Thank you so much for that presentation. Thank you, those who have joined us for the live session. We appreciate your audience. I also want to send a shout out to Dawn Marie, who designs our thumbnails for the webinars. If you need any graphics design services, she's the person to talk to. She's a marketing specialist. That's all from me, Eric Gitonga, your host on this AHS-AGHS webinar series. Have a good night. Asante Bwana Jeff.
Thank you, Eric, and everyone.